In this extensive episode, Dr. Liz and I have a very insightful discussion with Dr. Dean Busby about numerous myths about sexuality, from gender differences to religiosity to sexual experience, menopause, pregnancy, and so much more. Trust me, you don't want to miss this extended episode to hear about the truths and science behind human sexuality from one of the most knowledgeable professors in the country on this topic. He opens up and directly addresses important issues about sexuality that all couples need to pay attention to. Dr. Dean Busby is a professor in the School of Family Life at Brigham Young University. He received his Ph.D. in family therapy from Brigham Young University. Following his schooling, he taught at Syracuse University and Texas Tech University, where he was the department chair before returning to Brigham Young University. He is a published author of books, book chapters, and research articles in the area of marriage relationships, sexuality, assessment of couples, and relationship trauma. His research has garnered university and national awards and been funded by federal and state grants. Dr. Busby has taught at the university level for more than 30 years, primarily in the area of dating and marriage relationships, sexuality, and research methods. His courses are popular and well received. Dr. Busby has been married for 40 years, and he and his wife Colleen are the parents of 3 sons and the grandparents of 10 grandchildren. We hope you enjoy the show. Hey friends, welcome to another episode of the Stronger Marriage Connection podcast. I'm Dr. Dave here, Utah State University professor here in family life, alongside Dr. Liz Hale, our licensed clinical psychologist and marriage family therapist. Now we are bringing you the best we have in research, resources, along with tips and tools to help you create the marriage of your dreams. Okay, Liz, I am super excited about our discussion today. We know from the research that one of the most difficult topics to tackle and discuss in marriage revolves around sex. So today, Liz and I are joined by Dr. Dean Busby, a professor and colleague at Brigham Young University, to discuss common myths about sexuality. Thanks so much for joining us, Dr. Busby, on our podcast today.
Pleasure being here.
Now, yeah, as we had mentioned before we hit recording, this is going to be such an important topic to discuss openly. We're going to be direct. We're going to ask some talk to Dr. Busby about all kinds of myths, and we're going to be pretty open about, because it's such an important topic, and so we'll treat it with the importance as well as the respect that it deserves. But that's where we're headed today on our topic. Hey, Dean, before we start diving in, starting more with the big picture, a little bit about you, your PhD in family therapy. Why jump into these deep waters with such an important and serious topic?
Well, initially, I've always been interested in couples. It's been my primary interest as a clinician and as an educator and as a scholar. And so when I first started studying couples, I started out studying communication. And after a few years of that, I didn't find anything unique to couple communication that was different than any communication we have with friends and other family members. Oh, that's not what distinguishes marriage from other relationships. So then I dug into conflict, more about, the way that our relationships don't work and we get into fights. And I found that conflict's conflict. It's the same across different relationships. There's unique ways we can push each other's buttons sometimes when we're married, but it's the same process. So then I said, what is it about marriage that sort of uniquely defines this relationship from all others? And it just boiled down to sex. It really did. What is unique about marriage is you bring, your ability to communicate and manage conflict to a way of expressing love, which is your whole body. And that we think of as being the place for that expression of our full love with our bodies, marriage, and that's called sexuality. And so I went more into that area and sure enough found that it was always one of the top 2 reasons couples discussed as to why they were struggling when it wasn't working. And it was also one of the top ways that relationships started moving in a really good direction fast. And so I thought, well, there it is. And so since that sort of arrival that this is the core uniqueness about marriage, last 15 years or so, it's been my primary topic of scholarship and teaching is sexuality. And I don't regret going there. It's been a blast, really, to tell you the truth. There's just so much to learn, so much to know, and so many unique ways couples can get off track about this stuff. And we're so confused about this topic in America and in a culture, really, frankly.
Yeah. Oh, thank you.
You have such a positive attitude about it, Dr. Busby. I mean, thank goodness you're the one that's teaching these courses at BYU. I'm so grateful. And you said that we're really kind of divided in our sexual experience and in our philosophies, even in our comfort level, that there's really one extreme to the other. Do you mind just saying a little bit about that?
Yeah, I mean, I think what tends to happen is we have groups of people who feel like sexuality is what they would call a sacred and sensitive topic. And so they frankly tend to not talk about it. They don't educate their kids much about it. They teach their children to stay away from any kinds of sexual media, which most of us would agree with. But as a result, they tend to struggle with understanding it because they just so much ignorance and so much lack of comfort with the topic. And then we have people who feel like anything goes, casual relationships, casual sex is perfectly fine with, people are more objects to meet my appetites, that sort of thing. And so then that group is far over on this other side of sort of losing the part of sexuality that can really have power to hold couples together. And it's very common whenever you talk about sexuality to get people in both of those groups, and they're hard to bring together, hard to find this place in the middle, a common ground to sort of talk together. So,
yeah. And you said occasionally you have a student who has a hard time in class.
Oh, definitely. I always there, and there's different reasons they have a hard time. Sometimes it's because they have had no exposure to the topic, and so it emotionally floods them and overwhelms them. Other times they've had trauma. Sexual trauma is real and it's common, far too common. And so then there's other things that happen to them in terms of their trauma response. And then sometimes there's people that have made a lot of mistakes in the sexuality area, and they're just so confused about it. They're so unsure about how to manage these strong feelings and emotions that they're just in this very difficult place. Yeah.
Wow. So you're teaching and advising and helping the recovery and really correcting thinking, right? We have a lot of crosswires when it comes to sexuality. That's what I've discovered in private practice anyway. The topic, of course, comes up regularly. And even if the struggles that a couple's having aren't directly related to sexuality, they seem to spill over and affect their sexual intimacy. So today, Dave and I would love to tackle some common myths about sexuality with you and go from there. Let's start with some myths about experiencing sexuality for the first time. So here's one, Dr. Busby. Sex is something that just comes natural, right? So couples don't need to do anything to prepare to make this part of their relationship and for it to be successful. Myth?
Yes, definitely a myth. This is an interesting one. It came initially from a close friend. He had 4 daughters, and one of them was getting married. And of course, at the time, I was in the middle of this career where I'm educating a lot of people about sexuality. So I says, well, did you have any talks with your daughters? I was a real close friend, so we could get into this a little bit. And no, my wife and I, we never needed anybody to tell us about it. It's just sort of, and nobody has to tell the farm animals how to have sex. They sort of figure it out. And I looked at him, I says, now, are you serious? Because I don't know if you've watched farm animals have sex before, but that's not the way I want my children to experience sexuality. It's a pretty brutal experience, and it's not something that's going to work just naturally. And so he said, yeah, well, that's probably true. And then, we started in this conversation, and I just thought about that. And this was a well-educated man. This was a man who cared deeply for his children. But he just felt like, well, it's going to take care of itself. It's going to just happen the way it needs to happen. And I think the reason it's such a common myth is because we do have appetites, right? We know we have sexual energy, sexual drive, we call that. And not everybody, but most people have that at a significant amount, especially when they're younger. And that feels like one of the reasons we move towards people. We're attracted to them and we act in certain ways. And so we just kind of go with those appetites. But as we know in our modern world, think about our appetites, our appetites for food, our appetites for substances, our appetites for sexuality. Appetites given free rein don't usually create the kinds of outcomes that we want in life. They really don't. They have to be directed in certain ways. They have to be given information so that we know what is the purpose of this appetite, how is it most likely to lead to healthy relationships, etc. And that's not part of the natural way. That's, just acting on sexual impulses naturally will get us into really bad places really fast. So you need a lot of information and you need understanding about the opposite sex in particular, so that you don't assume that your partner is having the same kind of experience that you're having.
Well said.
Yeah, such an important one.
And we're going to probably just kind of rapid fire a bunch of these, Dean, to you. Here's another one. Sexually experienced individuals, meaning people who have had sex with several other people besides their current partner, make better lovers. What do you think about that one?
Yeah, that's a real common one. I did an article about a decade ago on, it's called Sexual Restraint. The research article that I published and got a lot of attention, lots and lots of attention. Basically, the finding was that the more partners that you've had prior to your married partner, it's just more sexual partners you've had prior to your married partner, and the earlier you had sex in your relationship with your partner before marriage, the less quality of sexual relationship that you had and the less quality of your overall relationship. So it was actually the opposite of that. And this got all kinds of media attention. All these people want to know what's going on here. It was sort of fascinating experience to talk to all these media folks. And so there is, and I've thought a lot about this one. In fact, the percentage of couples who actually enter marriage now without having prior sexual experiences is smaller than it's ever been in the history of the United States. It's in the 15, 10, even some are saying below 10% now. And so it's a smaller group. And so a few years ago, I went to find what I thought of as the most exclusive group of people still left in our modern world. And they were Mennonites down in Belize. And these Mennonites, they don't have any technology. They don't use electricity. They don't use media. So they're not exposed to the sexual media at all. So that part of our exclusivity was missing from their lives. And their marriage process is that they typically marry the first person that they've ever dated. They get permission to date from the parents of the person they want to date. And they don't have any physical contact, most of them, before marriage. At the most, holding hands. That's the most. And that's sort of even controversial with some. So think about a society like that. And so I went down to talk to them, interview them about their sexual lives after they've been married. And I was in the middle of this conversation with one of them. And I said, people in the world might say that your lack of experience and any physical contact and such before marriage might put you at a big disadvantage for making the sexual part of your relationship work. And before I even got finished with that question, he's wagging his head like, oh no, that's just not the way to think. And he just almost started, he was so emotionally driven by this, question. He says, it's just such a wrong way to think about relationships. When you marry somebody, you have to give them your whole heart and your whole body and everything you have to make that marriage work. And the idea that somehow giving that to a bunch of other people is going to transfer to the person that you're married to for the rest of your life just doesn't make any sense. And it's sort of this, and so it got me thinking about, do we have this backwards, this idea that getting more experience with more people somehow makes us better lovers? And there are so many elements about the sexual dynamics in marriage that are really specific to the individual that you marry. Their body parts are unique. Their nerve concentrations in the different parts of their genital regions are usually unique, almost as unique as the fingerprint of each person. So that means what kinds of things stimulate them and get them to enjoy sexuality are different from any other person in the world. And you have to learn those things in a very trusting environment. And so to do that, the idea of experience with other people makes it actually harder to get to rather than easier, because you're trying to learn the specific map, the love map of the specific person that you marry. And that other stuff from other people actually interferes. It's baggage. It's things that cause noise that makes it harder for you to get to this place where you can have the kind of relationship you want. So oddly, that idea of more experience with other people is better. It doesn't show up in the research, does it?
A related one to that, Professor Busby, is highly religious couples, right? Highly religious couples are more likely to have sexual hangups, right, than couples who are not highly religious. Miss?
It is. The high religiosity, and we've looked at this from a variety of different types of religions and levels of religiosity, is a protective factor in general. In other words, couples who are highly religious tend to have better sexual relationships, even more frequent sex and more enjoyable sex. Now, that doesn't mean that there's not subsets of highly religious people that don't have some specific challenges. And one of those is extra levels of inhibition, because they haven't often had very good sex education and they have a difficult time discussing it. But to counteract that possible problem with more inhibition is there much higher levels of what we call sanctification towards sexuality. When you come to sexuality and see it as a sanctified place in marriage, as something particularly sacred to you and important, you put more commitment and effort into it. And that overcompensates for any of these other things they might bring. And so one of my agendas has been, as a religious scholar and a religious professor, has been to sort of reduce the inhibitions in the highly religious group so they can have even more of an advantage in their relationships. But even without that reduction in inhibition, they're going to find out some things and work out some things over time, because they take it so seriously and they work extra hard to make the sexuality part of their relationship meaningful for them. And so it tends to compensate for some of that.
You know, Dave and Dr. Busby, I was on a radio show maybe a year ago, and we were talking about that very research about the more experience, sometimes the more harm. There was no judgment to it, but more alarming, ringing the bells, right? Sounding the alarms for maybe parents to talk to their children and to prepare them a little bit and explain that experience is not what's key here. You know, it's so interesting. I didn't feel like it was very popular. I haven't even been asked back. I'm not sure that went over so well. It makes me think about this. Anyway, there's another common myth. Tell us what you think about this one. Most couples are very successful at developing sexual patterns that work for both partners most of the time. Missed?
Yes. There are probably only a third of couples. The long-term, this is a longitudinal research over many decades with couples, shows that about a third of couples develop a sexual process that is highly satisfying and works across the length of their relationship. So that's a third we want to be in. Everybody wants to be in. But that leaves 2/3. 2/3 of couples have substantial challenges, and most of those challenges endure for the life of their relationship, unfortunately. They get established in the first couple of years of marriage, and they get rigidified, and they just get repeated. And they don't seem to break out very well from those problems. So there's a lot of work to be done in this area. There's just a lot of improvements that can be made. We want to get into that top third. The good news is that even established couples that have had these years of patterns that aren't particularly healthy can make adjustments and can shift. And can improve, but most of them won't on their own. They have to get new information, whether it's through educational experiences like you folks are doing, therapy, or other avenues. They have to sort of have something that helps them fundamentally shift the way they think and the way they act about sexuality.
We'll be right back after this brief message. And we're back. Well, let's dive right in.
And what about this one? Most couples communicate openly with each other about their sexual relationship and their needs. I had a professor who once said, if a couple can't talk about sex, they ain't not be doing it. but we can talk about it. I'm a professional. I kind of stumble over my words sometimes when it comes to sexuality.
It's such a hard topic to consistently talk about. We know that it's the one you're least likely to talk about in marriage compared to other topics, and that you're least likely to keep talking about in marriage. And so it is fundamentally difficult to talk about sexuality. And this is even people that don't have strong sort of inhibitions about it. They just find, and I've really thought I don't think there's too many people that have talked more about sexuality than I have to large groups of people. And still, when it comes to individual people, friends, family members, etc., where we need to have a conversation, I still find a little bit of reluctance. And I thought, what is that coming from? For me, it's no longer about, well, this is wrong or this is some sort of inhibition kind of thing. I think it's about the privacy piece. It's a private, sensitive area. And so there's always going to be a little bit of, this is going to be a little more challenging. This is going to be a little harder. So then we let that reluctance get in our way. And what we know that one of the most important things that distinguishes couples that work well versus those that don't is the ability to be open and consistently communicate about sexuality. And it's the hardest thing to do. And so, yeah, that's the one we have to keep chipping away at, no matter how old we are.
Mm-hmm. Do you have a starting point, Dr. Busby? Do you?
What I generally do when I first get with people I haven't worked with before in an educational or therapeutic setting is I want you to just sort of start out with this idea that you're going to sit down and have an evaluation inventory of what's going on in your sexual life. Start with that. How is it for you? How would you like it to be? How would you like things to be different? What would you like to keep the same? Just start with that. And both of you take some time, sit down, think about it, maybe write a few thoughts down in an outline form, and then sit down and have a talk. And then start doing that at least a couple of times a month until it's natural, until it's just part of the way you manage your couple relationship. And once or twice a month is enough. If you keep on top of this and you catch patterns that are starting to not work, then you can really make a big difference. You don't have to have these talks all the time, but you need to have them regularly.
Yeah, so important. And it doesn't matter if it's 5 years or 50 years. If you haven't had these talks, you can start. And it may be awkward at first, but developing that pattern and regularity, some type of regularity.
Yeah, because I think naturally, too, the other piece that makes us reluctant to talk about it is a lot of our communication about sexuality is nonverbal. We send messages through our bodies, through the noises we make, through the expressions that we have, through the ways our bodies respond to one another. And that's nothing wrong with that. And nonverbal communication is super important. But of course, you can't really get to some of the details of what is or isn't working for somebody without sitting down and putting words to the experience. And that's the thing we're reluctant to do because, of course, you don't want to stop in the middle of a sexual encounter and say, well, let's talk about this. That's the best way to kill that sexual encounter. So since we think of sex as a mostly a nonverbal experience, we carry that over into the pre or post-sex conversations, and we don't keep talking about it.
Yeah. Oh, man. So important. Let's tackle a few more. Let's switch to gender myths. There's some common myths about gender differences with regard to sexuality. Let's start with this one. Men have a much higher sex drive than women. What common myth? There's some truth to that. Where's that one?
There's a little bit of truth to that. In the 20s and 30s, men have a significantly higher sexual interest, sexual drive, we call that. But it's not much higher. So if our scales go from, once a week to a couple of times a week to 3 or 4 times a week to every day kind of stuff, it essentially moves. The males might be at 2 to 3 times a week and the females are at 1 to 2 times. So there's some overlap, but a little bit more interest in male in the 20s and 30s on average. But this is the key thing that's come out in recent research, and this is super important. And it's been my sort of thing I've been really working on a lot in the last couple of years. If women have good sexual startup, meaning their initial sexual experiences in a particular relationship, and even their sexual debut, whenever their first experience was in their life, if that experience is positive and not painful, and it's connected to a loving relationship, their sex drives are not significantly lower than men's. Isn't that interesting? So what seems to be happening is, and we know this from a variety of studies, is that on average, women have their first sexual experiences are not particularly good, just to be frank. They typically include some degree of pain. They go at a pace that is not consistent with their physical needs. It's too fast. And then, and they don't have understanding of one another's bodies, especially the male understanding the female system. And so then the experience is not matched to their physiological needs. And so they're having this experience, and the guy's, reaching orgasm very fast and going through this experience and thinks it's great. And she's having particularly painful experience and not enjoyable experience. So think about what that does if your initial sexual experiences are about pain and difficulty versus enjoyment and love. I mean, that makes all the difference in the world, doesn't it? So you have to make some pretty fundamental shifts to make that work for women. And if you do, you don't have these common difficulties with one person having way more interest in sex than the other person. I mean, we can imagine this in anything we like to do together. If you like to play tennis together, but one of you has an injury, every time you're out on that tennis court, it's painful and you can't move the way you want to, and it's just not fun. Well, guess what? You're not going to be playing tennis together very long in a way that works for you. It's the same thing with sex. So, and if go ahead.
No, go ahead, please.
And so, so you really, what you have to do with the couple, and this is it's a different startup process, and it's hard for couples to get their heads wrapped around this, is the first sexual experiences need to be primarily driven by the women's response and readiness. So what I suggest to couples is, if you're virgins and you're having your first sexual experience, that you do not want to have the imperative of having intercourse, vaginal intercourse. We call that PVI. That should not be on the table the very first time. It might happen, but it's not a goal. The goal is to get comfortable with your bodies and to move at the pace where the female feels comfortable moving to the next steps, not the male. And what typically happens is we move at the pace of the male's, because his arousal process is so fast that we have to hurry and have sex before he orgasms. Well, you've got to get that out of the equation. If you don't get that out of the equation, then you have all of the common problems of early debut that we don't want to have. We have pain. We have, and once you get pain with intercourse going on with women, then you have a variety of other things that start happening, like vaginismus and other things, where the body automatically responds in the opposite direction of arousal. It shuts down, it closes off, and sex becomes harder and harder and more difficult. And once that's going on, it takes months to unravel that. No need to have that problem. So if instead you say, okay, it's not about the male's pace, doesn't matter whether he's going fast or not, we're not going to have intercourse based upon his pace. We're going to go with her pace. And when she's ready and when she invites and her body is ready, then they can move to intercourse if they get to that place on the first couple of experiences. And they very well may not. As they're learning about their bodies and getting comfortable, she may not be ready. And so what? 2 or 3 or 4 times into this, then finally she is ready, and everything feels safe to her, comfortable, her body's ready, no pain. It's about loving experience for both of them. Their sexual desire is going to be very similar, and their enjoyment is going to be very similar. And so you see the shift that's very different than the typical debut experience of sexuality, especially in our modern society, where the first experiences of sexuality are teenagers trying to hide from parents, in cars, in basements, in places that that they don't have time, they don't have space, they can't pay attention to her needs, and his pace is super fast. and everything is wrong about that debut. Everything is wrong. And so they're starting out with, for her, sex means pain, difficulty. I don't know what the big deal is about this at all. It didn't feel loving to me at all. And that's that. And then we have a pattern set that's really hard to shift.
And I was going to mention that pattern, then I keep coming back to that 1/3 and 2/3, right? Yep. I mean, I'm assuming these are related to what you're doing, that debut, those first few days, weeks, translate into these years and the habits, and then you result in the 2/3 that you're talking about, right?
That's correct. That's correct. You can map it all the way through, and it doesn't really shift. So sex is driven by his initiative, his needs. She's sort of, well, whatever. It's not that enjoyable for her. So of course her interest level is reducing. His frustration is increasing, and now instead of sexuality being something that can really bring them together and help, it's something that's pushing them apart, and it becomes a core issue of conflict.
Yeah. Wow. Just breaking this down, I think is helpful. Hopefully it's helpful for our listeners as well. Here's a related one related to gender differences. Women generally are fine with most sexual experiences being more for the guy than for them. What do you think about that one?
Well, that's absolutely wrong. Women,
what a shame that would be, right?
Yes, women.
Yeah,
women's bodies are frankly more capable of having more enjoyment and more levels of enjoyment than men's bodies, and they need it and they want it. And so this idea that just cuddling fine for most women most of the time, that's a myth. It's a total myth. Of course, every single sexual experience isn't as equally enjoyable for both partners. That's just part of the natural process. But most of them need to be fulfilling, and they need to be satisfying for the woman. And she needs to be reaching orgasm. And one of the things that we know is that about 40% of women didn't reach orgasm in their last sexual experience and don't usually reach orgasm. And that all stems from poor startup, and the pace and everything is not about her needs, and it just continues. And so then, of course, she's consistently not having enjoyable sexual experiences. And she needs those. And it's core for her to feel loved and to feel that her marriage is working well, just as it is for the male.
Wow. Very helpful.
And another myth about gender differences, Dr. Busby, men's and women's pace of arousal and pathway to orgasm are similar. Another myth.
Yes, very, very, very different. The typical male, especially early on in a sexual relationship, will be at a place where their arousal level is close to orgasm within 2 to 5 minutes. The typical female, it's 20 to 25 minutes. So you can see the difference, and you have to bring those two together, or you're going to be pushing those two apart. And so their arousal process is just fundamentally moves at a different pace. Now, both can learn to move. Women can learn to move a little faster sometimes, and men can learn to move slower. And so as they work together and they get a process that works, they might settle in at 17 minutes or something rather than at 3 or 4 or 5, or rather than at 40 or 50 minutes. But the time isn't as important. What is important is that they get their arousal templates to sort of work together. And that takes some learning. You're learning a specific way of managing your arousal process, and that's not easy. So there's going to be a lot of sort of figuring things out early on, and you're learning how to manage the arousal process of your partner who has a totally different body than you do. And you can't assume that your partner is experiencing what you're experiencing. That's where that communication is. Oh, that was really great for me. Well, not really for me. Oh, and then you have to have that difficult conversation. Yeah.
Isn't it interesting? So even in sexuality, we have to think about our other partner, right? Even in sexuality.
Definitely.
There must be a reason for that, I'm sure. What about this one, Dr. Busby? Satisfaction is a sexual area. Let me start that again. Satisfaction in the sexual area is based on different criteria for men than it is for women. Myth?
That one, yes, it is. It would seem like all the things we're talking about, different bodies, different paces, that would be sort of their satisfaction levels would be based upon different things. They really are pretty much the same. That is, both partners want themselves and their partner to be having an enjoyable physical and a intimate emotional experience. So they both need to feel like this drew me closer to my partner and this was enjoyable physically. And if they get both of those things, then what happens is the two primary purposes of sexuality, which is to sort of have a process of enjoying our bodies with one another, and the second is to bond emotionally, those things happen. And if those things both happen regularly, then both partners are pretty happy with their relationship.
Let's pivot again, Dr. Busby, because I want to discuss some common myths about sexuality across the lifespan. For example, here's one. It's inevitable that most couples will experience a dramatic decline in their sexual satisfaction across marriage. What do you think about that one?
Yes, it is not inevitable. It is, as we talked earlier, there's that 1/3 group that have a dynamic and healthy sexual relationship, and they seem to maintain it for the rest of their lives. Now, this doesn't mean sexual frequency is the same for the rest of their lives. Sexual frequency does seem to step down a little bit over the decades, but not dramatically. It might go from 2 to 3 times a week to 1 to 2 times a week to once a week or so. As you get into your 60s and 70s, it does move down. But the quality of that sexuality is something that doesn't inevitably need to move downward. Now it will go south for most couples who don't stay on top of their sexual relationship, and they're just primarily driven by those strong interests of attraction and hormonal interests early in relationships, because the hormones will shift. What I teach couples is that if you don't shift from primarily what we call the mating hormones, that's estrogen and testosterone, to oxytocin, which is bonding hormones, if you don't make that shift in the first 5 to 7 years of marriage, you're in trouble, because those hormones are going downward. That's just, our prime time. Those hormones are made for mating and reproducing. And our prime time for doing that is in our 20s and 30s. Well, we're married for, we hope, for the rest of our life. And so as those hormones are going on this path like this, if you're just basically having sex in a response to those mating hormones, and you haven't learned how to bring oxytocin bonding into the middle of your sexual experience, you're in trouble, because you'll have sex less and less often, and it'll become more and more frustrating with you as the hormones go downward. And you won't have learned to have sex because you want to make love to one another. You want to show love for the rest of your life. And you haven't learned to make it a core part of your bonding as a couple. And so then you're gonna inevitably have low levels of sexual quality.
Yeah, that's helpful. Thank you.
And what about myths around pregnancy and childbirth, Dr. Dean? Most couples navigate pregnancy and childbirth without experiencing any challenges in the sexual area. Yes, myth?
Other than the difficulties of sexual debut and getting that right, the next most difficult shift in the sexual relationship of a couple is the birth of the first child, and any pregnancy, frankly. A woman experiences in 1 month of pregnancy the same increase in the quantity of hormonal intensity as she would in 9 years outside of pregnancy. So her hormonal system is going haywire, to be frank. And it has to, because the hormones of the woman are what primarily dictate the sex of the child. So if it's got 2 X's or 2 Y's, it determines I need a lot more testosterone, I need a lot more estrogen, I need to develop into a male or a female inside of the womb. And so her body is making those adjustments she has no say in that, right? It just happens. And that shifts her feelings about sexuality dramatically in pregnancy. Some women find, other than those with strong morning sickness, of course, that's a big sort of problem early in pregnancy for many couples. Nobody wants to have sex when they feel like throwing up. It's just not part of the equation, right? So morning sickness is a challenge. But other than that, some couples find that they have more interest in sex. Some couples find they have less interest in sex during pregnancy because of this hormonal shift and process that's going on. And then, of course, there's the fatigue issues and everything else that goes with pregnancy. So pregnancy is a really challenging time. Fortunately, it's only 9 months. But then you've got the new baby, right? And as everyone knows with kids, you have all of these things. Then the hormonal system has to restart for the female again. And depending on whether she's nursing, that's going to be a different kind of restart than when she went through puberty the first time. And so her body's going to do all kinds of interesting things as she is postpartum. And those may be better for their sex life. Those may be worse. They have to be talking about it. They have to be negotiating. They have to be figuring this out. And then we've got this huge challenge of fatigue. And fatigue is a big killer of sexual energy. Anybody who's been exhausted knows the last thing they want to think about is something else to do that's physically demanding, like sex. You just roll over and go to sleep, right? Because you're exhausted. And then just at the time when you do get interested, then, of course, the baby seems to know that's the time to cry, right? And then needs fed. And so but then you have to negotiate. We have a third person in this family, and we have to figure out now how to plan sex rather than just let it happen whenever we feel like it. And so that series of transitions, the postpartum issues, the hormonal processes, the new baby, how you're going to manage babies. I mean, I had one couple, they were still having their baby sleep in their bed when he was 4 years old. Well, of course, that interfered with their sex life substantially, right? And so their idea of if we love, this child cries every time we put him in his own room. And so they gave up essentially their sex life for what they thought of as the well-being of the child. And so that's just a simple example of how negotiating and becoming parents has to be integrated into being a couple. And a lot of couples don't figure that out very well. And it creates all kinds of new challenges. So yeah, you have to have a whole nother set of intense conversations and experiences with sexuality after the baby is born and figure all that out. And it's new terrain. It's a new.
As you're talking, I'm almost thinking like there's another sexual debut. Maybe sexual debuts happen continually throughout the lifespan of a couple.
That's probably true. It's probably a good way of thinking about that. Yeah.
And what about this one? Couples who have enduring high quality sexual relationships across time have an unusually high level of sex hormones and sexual desire compared to couples who have low quality sexual relationships.
Yeah, that's an interesting one. We kind of think of, we see these couples at 1/3 and they're just so in love and they're still, 25 years into this marriage or 30 years, there's still so much. And we think of them, there's something odd about them. What's wrong with them? Maybe they just have these really strong hormones and they're fortunate. It really doesn't seem to be related to that. It's not, it's that shift that I talked about where you shift from, it's a mating kind of driven sexual experience to an oxytocin bonding kind of sexual experience where they make a decision. We call that the difference between seeing sexuality as a growth area or a destiny area. If you think about sexuality as destiny, you have the attraction or you have the energy or you don't, and you act on it or you don't. Then you're just going to go with the hormones and your sexuality is going to die. If you think about it as this is an area of central importance and we're going to have to work at it and grow together, then you learn to bond with your bodies. And you're not really primarily paying attention to the hormones. It's like when you feel like having sex, you're having sex regularly because it's a central mechanism for bringing you together and creating increased love. And so you're choosing to be sexual and you're choosing to keep being sexual regardless of what your bodies are saying in terms of the hormones. And those hormones shift substantially across the lifespan. And so you can't be a slave to those hormones. You have to learn to have the relationship you want to have together regardless of the hormones.
That is a great point. I love that. Thank you.
We'll be right back after this brief message. And we're back. Well, let's dive right in.
Here's another one for you, Dean. Couples generally have sex or initiate sex for the same reasons, such as sex drive, across the lifespan.
Yeah. It really seems initially most couples do, to be even couples in that top third group. Initially, they seem to primarily initiate sexuality because of a physical hormonal push. But most couples figure out pretty quickly, if they're going to have a good sexual relationship, that that isn't going to be good enough. Because it may be that one partner has more of those hormones at a particular time than the other partner. And what we know is good for sexuality is when both partners initiate sex. Not necessarily equal amounts, but that both partners are consistently saying, hey, I want you, I care about you, I'm interested in you physically and emotionally. And so you have to find a way for both people to initiate. And sometimes that can be a challenge when, again, you're at different places physically. It can be a challenge to let that happen. Sometimes you have to schedule that sort of thing. Like one of the things when I get a couple where it's almost, one of my first questions is, so in the last couple of months, who initiated sex? And if it's all one person and not the other person, we have to start an exercise. And the exercise is, for the next 2 weeks, the person who hasn't initiated sex is responsible for whatever sex happens in your relationship. And the other partner has no say in it, right? And of course, the person who has been initiating sex initially freaks out about, oh no, we're not ever going to have, that's their panic, right? We're never going to have sex. But you always start with those person who hasn't been initiating sex. Give them space to sort of work that out, have permission to initiate, and they're not trying to sort of meet their partner's needs. It's about their need. And when you do that, what's interesting, and then after 2 weeks, you shift to the other person. Now it's your turn to initiate. And the person who hasn't been initiating sex, oh no, we're going to have sex every day. It's going to wear me out. Doesn't matter. It's really fascinating. Almost every time what happens is they settle into the same level a couple of times a week, once or twice a week. When they have space, it's no longer a conflict about initiating, no longer just one person's responsibility. They find a place that looks about the same, but now they're both initiating. And then you have to figure out how to do that across time.
Yeah, I like that exercise. I've never heard of that. That's great. What about this one? Menopause. Oh man, menopause. Menopause is generally a negative factor in couples' sexual lives. What happens to sexuality as people age?
That has to be a myth, because there's two groups that does not attend to. Menopause is the great wild card, I call it. You don't really know what it's going to do to the woman's body and the couple's relationship. You can't predict this. There's really not enough data and research to say, okay, we can pretty much predict this is what's going to happen to most couples. You cannot do that with menopause. It's such a dramatic shift. And so so there's the two groups of people that's a myth for. Is there's a group of people that go through menopause and really their sex lives don't really change much at all. They work through it. It doesn't seem to be much of a blip at all. There's another group that it actually improves. And it looks like for that group, there's a couple of things going on. It's a relief to not have to deal with menstruation anymore and ever have to worry about pregnancy anymore. And what's interesting is a woman's body, what stops getting produced through menopause is the estrogen cycle. But her testosterone doesn't stop getting produced. It does go down slowly over time, like it does for a man. But actually, the proportion of estrogen to testosterone can shift for a woman. And when her testosterone's higher in proportion to its estrogen, she can actually have a stronger sex interest. So that's probably what's happening with that group that sort of find this is better. You know, there's relief because they don't have to worry about pregnancy and menstruation, and there's shifts in hormones that increase interest for some. There is the other third are going to have substantial struggles through menopause. And some of that is because they've already been having struggles and they don't have the communication and the relationship strengths they need to work through those. Others, it can be a difficult transition. There can be shifts in the lubrication for the women that if you don't pay attention to them and you use lubricants and other things to help, it can become a painful experience. And of course, once we get pain attached, then we stop doing something. So then that's part of that problem. There can be other challenges, of course, with menopause. There can be pretty intense hot flashes and other physical symptoms that are pretty disruptive. And there's good medications that can help with a lot of those things. So if you're in that group where you're going through menopause and this is really breaking down your sexual relationship, get some help. There's a lot of things that can help with that. But the other 2/3, I think, have a reasonably good chance of getting through that with the same or even better sexual relationship. So,
that's interesting. Thank you.
Yeah.
We do just a couple more. All right, let's go for it here. True or false? Once the kids leave home, sexuality naturally improves.
Yeah, it doesn't seem there's a second blip. David probably knows more about this than I do in terms of divorce rates that occur around that. So the highest rates of divorce are early in marriage, the first, 5 years or so in that range. And then there's another one around I think it's 25, 30-ish, whenever the launching period, where divorce gets a little higher again, smaller blip than the early one. And that seems to be related to couples who now they don't have children in their lives, and they have let children be the center of their relational lives. And their relationship is so frail and brittle that there's not much left of it. And it's hard to reinitiate and have to rebuild that relationship. A lot of them give up at that point. And that's some of those are those couples that stayed together for the kids. They didn't want to have a divorce. Unfortunately, when your parents divorce, even when you're an adult, it's still very difficult for the children, regardless. And so that some of them are that group. Others, if they had sexual problems before the kids left home, those problems aren't going to go away now just because there's nobody in the house. They're probably actually going to get a little bit worse because there's now not distractions. And you have to either face them and deal with them and improve, or you just decide to give up on the relationship. So
painful. Oh, okay. And then this one makes us all smile, of course. Sexuality between middle-aged or older adults is just gross. Not sure who said these things.
Every semester, my students say these things, to tell you.
That's where they come from.
That college age, when they think of their parents being sexual, they are so grossed out about that. It's astonishing to me. And I asked them, well, what is that about? I mean, wouldn't you want your parents to be enjoying their bodies and showing love to each other? I just can't even imagine it. And they just get so uncomfortable. And so one of the things I tell them, and I sort of strategically do right around the Thanksgiving break, is, hey, when you go home now to Thanksgiving, I want you to remember that about the age of where your parents are, if they're having a good relationship, they're probably having the best sex of their lives. So just think, stop it.
No, I don't want to think about that.
But then part of the message is, of course, that if you can get this sexuality working and keep at it and keep evaluating it, it can be this wonderful thing that doesn't end in the life course. I mean, it's part of their whole relationship. And it's a beautiful thing to me to think about 80-year-olds enjoying their lovely bodies together, showing each other how they love each other, and knowing exactly what their partners need and having full trust and confidence. I mean, that to me, that's sort of like the capstone of a lifetime of effort. That is a beautiful thing to think about. And yeah, bodies get old and wrinkled and things shift, but good sex has really little to do with the shape of the body and the looks of the body. It's really much more about the quality of the relationship and the effort you put into that and the love you show one another. And so that to me is the way of helping young people separate out sex is only for the young and the vibrant and the hormonally intense people. That no, it's going to get better and better. And it's going to actually get best around mid to late life, when so many of your hangups about, what you think it needs to happen in your 20s and 30s, you've let go of. So.
Yeah, that's just really beautiful. And if we mid-adults don't want that to end, that great sexual experience, why would we ever want that to end for our parents as well? Right?
Exactly.
Sometimes we forget that's how we got here. Every single one of us.
Yeah.
Oh, Dr. Busby, please tell us, where can we find out more about you, your books, the reports, other info that may be helpful for our viewers and listeners, for all of us?
So my co-author, Dr. Levitt, who also teaches at BYU, she does most of the social media stuff for us. I'm bringing up her webpage here. It's Shalom Levitt, CHELOM, LEAVITT.com. And so she runs most of that part of our team. And there's podcasts on there. There's links to the couple of books we've done. We've done a book for children, parents teaching about both books currently are focused on the Church of Jesus Christ of Latter-day Saints audience. But we are making a new one that's more generic about sexual wholeness. That should be out hopefully in about a year. And so anyway, that website will have the links to the books. You can go on Google Scholar for me in terms of the research that I've done and look under my name, and it lists all of the research articles. They're pretty technical, most of them, and researchy, but most of them, you can access the discussion sections and the introductory sections and learn some things. And so that's where you find most of the research that I've done. So, yeah.
Oh, that's great. And we will put those links on our show notes for our listeners. So listeners, you can access those. We've had Shalom on before. She's great. Yeah. Great friend and so very knowledgeable. She's actually creating some e-courses for us here at the Utah Marriage Commission. So fascinating. It's so important topic. Hey, before we let you go, a couple questions for you. Number one is, in your mind, with all the research and the stuff that you've done, what do you feel like is the key, maybe even a couple keys to a stronger marriage connection and a stronger sexual connection, Dr. Busby?
I think in terms of the stronger marriage, the one that I hit the most is it's a sort of a mantra I developed a few years ago, and I just repeated it over and over, is you can't change another person. You can only invite them to be in a relationship with a better you. That's the sort of key idea, that if you want to move this relationship, move yourself. And then your partner, because they love you, they will move with you. But you can't do it by pushing them, in a particular direction. It just doesn't work. And so that's the general marriage one. I think in terms of the sexuality one, it's such a beautiful area of life to me. I've always been physically active. I've been an athlete when I was young, and I'm still very physically active. And to me, to be able to show somebody that you have committed all of your heart to, that you love them with your whole body, is such a privilege. That the body works, that it's designed that way, that we have a way of showing love that's so beautiful with our whole bodies. To me, I think you have to keep a hold of that. That it's such a privilege to be able to use our bodies as expressions of love. And it doesn't have anything to do with my age, my condition of my physical body, the look of my physical body. It has to do with love. Like that, when you give somebody a hug, you put your arm around them, you're not thinking about, well, this person's beautiful or this person's ugly or this person's, whatever. It's just beautiful that you can show somebody you care by putting your arm around them. And sexuality is like that to me. It's this gift of expressing love with your body. And so when I see and I hear people say they're making love with people they don't know in casual sexual encounter, I cringe every time. Not because I have this strong moral sense that this is wrong kind of stuff, but because it doesn't feel like love to me. You can't love somebody you don't know. And you can't give your whole body to somebody you don't know and that you trust. And so I think those, it can't become making love until you know how to love your partner, until you know how to show the love that they need. So yeah, I think that's
well said. Well said. Another question for you is your takeaway of the day. As we wrap up things here, we'd like to ask our guests, what is a take-home message that you hope our listeners and viewers will remember?
Start talking about sexuality in your families and in your relationships. There isn't a semester that goes by where I don't cry with a student about the damage that's been done to their lives because a parent has felt like we can't talk about that because that means they might experiment with it. And so they've had very difficult, unnecessary experiences just because of basic levels of ignorance. You've got to start talking to your kids. And fathers in particular have to start doing a better job. They are the worst in the whole family as far as who talks the least about sexuality is fathers. And they need to be in the middle of this conversation for so many reasons that we know. And so start talking with your children, help them to feel comfortable, like you're a trusted place to come and have a conversation about these bodies that they have and what's going on with these bodies and what is sex, etc. And then just do the same with your couple relationship from the very beginning of your couple relationships or wherever you are in your couple relationships. Just break the ice and start having these conversations. And it will open doors of connection and love that you cannot imagine if you can just start talking. Yeah.
Yeah. Wow, yeah. I love that. Yeah, thank you. Liz, what about you? What's your takeaway today?
You know, I keep thinking, Dave and Dean, about this woman, or the debut, the sexual debut, how important that is for the man and the woman, the bride and the groom, and what this responsibility is to us as parents or aunties, maybe even uncles, to really talk with our young people about the expectations of that. And that women, it's kind of like ladies first, right? We really base our sexual experience on the woman. And that's such a responsibility for men in their patience and turning towards a woman. And a woman also has a responsibility to ready herself for lovemaking. So we both have different roles that are very important in this wonderful cycle of life and sexuality. Dave, what about you? What's your greatest takeaway from our time together with Dr. Dean Busby?
Yeah, you know, the 2/3, Dean. I mean, that 2/3 keeps coming back to me. And I just think for years, you know, decades, and the 2/3 of people who it's uncomfortable, we don't want to talk about it or avoid it. It's painful and we just don't talk about it. But I feel like that there's hope. There's can be happiness in that relationship if they will. You touched upon at the very end of what you just said, Dean, is that of that communication, start a safe place, open up. It's a vulnerable place, and we haven't really talked about it. Why would we start after 20 years? But we feel like we're in a relationship rut. What do we do? And if they need help, Dean, I mean, there's therapy, right? Therapists, professional therapists that can help. And in fact, before we wrap up, any kind of tips? Where do people go? They're listeners. They're like, man, I'm in that 2/3. Where do I even start? Any ideas there?
Well, I mean, I think I don't start with therapy when I'm working with couples in this topic. I first start with starting to talk to one another. And then if as they talk to one another, they hit these fundamental blocks where they just feel like, you know, we are talking more, we've made a little bit of progress, but it's just stuck. Then I think you want to start talking about therapy and going to people that have some experience with this. And it's a little bit of a dangerous area in terms of therapy. There's a lot of coaches and things out there that don't have good training necessarily in the sexuality area. And so I think you want to look for people that have certification as marriage and family therapists, you know, practicing psychologists and social workers that are licensed and that have experience with sexuality. One of the curious things I've found is the professionals in the fields don't talk about sex as much as they need to with their clients. They're reluctant as well. So they have some work to do. And so you want to get somebody that has pretty good experience. They maybe have some additional training. At least they can talk to you about experience they've had working with couples around sexuality issues. Then they're going to be more comfortable about it, and they're going to be able to help you become more comfortable. And their experience will give them many more skills that they can use. But before you go to the therapy, I mean, there's good books, there's good educational programs. You folks are doing some fabulous work, and you know, get in there and start educating yourself about couple relationships, and that's going to improve your relationship and your sexuality. So I always say start talking to one another, then start getting educated, and then go to therapy if you need more. So.
Yeah. Great. So helpful. Thanks for the tips. Thanks so much again, Dr. Busby, for coming in and spending some time with us on the podcast. We sure appreciate you.
My pleasure.
All right, friends, that does it for us here at the Stronger Marriage Connection podcast. Thanks for joining, and we'll see you next time.
Yep. Thank you, Dr. Dean Busby. And remember, it's the small things often that create a stronger marriage connection. Take care now.
We'll see.
Thanks for joining us today. Hey, do us a favor and take a few minutes to subscribe to our podcast and the Utah Marriage Commission YouTube channel, where you can watch this and every episode of the show. When you hit the like button and leave a comment, your feedback helps us improve the show. And don't forget to share this episode with a friend. You can also follow and connect with us on Instagram at Stronger Marriage Life and on Facebook at Stronger Marriage. Be sure to share with us what topics you want us to explore or what you loved about today's episode. If you want even more resources to improve your relationship connection, visit our website at strongermarriage.org, where you'll find free workshops, webinars, relationship surveys, and more. Each episode of Stronger Marriage Connection is hosted and sponsored by the Utah Marriage Commission at Utah State University. And finally, a big thanks to our producers Rex Polanis and Alexis Alcott and the team at Utah State University. And you, our audience. You make this show possible. The opinions, findings, conclusions, and recommendations expressed in this podcast do not necessarily reflect the views of the Utah Marriage Commission.